Gastric Health Treatment Undertaking Services presents to you 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 Keith 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 Health Treatment Undertaking Services presents to you.
Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Keith Health Treatment Undertaking Services presents to you. Ke
Gastric Health Treatment Undertaking Services presents to you Undertaking Services presents to you KIF Health Treatment Undertaking Services presents to you
Good evening. On behalf of the KIF Health Treatment Undertaking Services, Professor Aisha Al-Dahiri and Dr. Leila Sheikh Ismail, the Chair and Co-Chair of Nutrition and Health Symposium webinar series, we are pleased to welcome you all to the NHS 2020, which is in collaboration with Emirates Nutrition Association. In the light of the current situation, NHS has been conducted with the previous two series through interactive sessions virtually, which each series is accredited by Department of Health with not less than 1.5 CME hours. We would like to take this opportunity to thank our NHS partner for today, Nestle Health Science. And once again, we would like to thank everyone, our collaborators, speakers, and attendees. We look forward that all will have a great time and informative lecture outcome throughout the NHS webinar series. Before we proceed with our webinar for today, we would like to kindly remind everyone that the course attendance is being monitored for the number of minutes you are connected to calculate the CME hours you will be receiving. Once we have gathered and finalized all attendance minutes of attendance, you will receive an email from us next week with 2 links for post-test and evaluation as a prerequisite of Department of Health. For those who will able to complete both links, we will send you within 10 working days the copy of your PDF certificate along with the presentation copy in PDF format of the course. Please note that the online post-test and evaluation portal will only be open for 1 month from the date of the course. So please make sure that you are able to fill both links to get back to us and send us a message or an email in case you will not receive any email from us within 10 working days. Once again, we would like to invite everyone to please like, follow, subscribe our social media accounts, Facebook, Twitter, Instagram, LinkedIn, and YouTube under the KIF Health Treatment Undertaking Services to receive announcements of our upcoming courses as well as view the previous recorded sessions. With that, for those who are unable to join us today, we are simultaneously live through our YouTube and Facebook account, which will be open for a few weeks. Without further ado, we are pleased to introduce to you our speaker for today, Ms. Wafa Aish from Department of Health, from Dubai Health Authority, Abu Dhabi, who will give us a lecture about Gastric bypass. Dr. Wafa, we would like to once again thank you for your time and for giving this lecture with us. We are always pleased to have you giving all this scientific lecture for our healthcare professionals. You may unmute your microphone and you may start sharing your screen.
Good evening, everybody. Thank you, Kim, for the introductory. My name is Wafa Aish, and I thank Kim for this sweet introductory as well. I thank Dr. Aisha Zahiri and Dr. Layla for inviting me to give this talk about the big gastric bypass diet guide. And this is like, steps to start with for whoever wants to know the guide for the gastric bypass patients. I start with 3 questions, and Kim, I would like to know the answers. I will give like 1 second, 2 seconds for maximum to answer. And these questions will be answered by the end of the talk. I try to give to make it as simple as possible with the practice that I have done with some of the patients that I follow. I hope you'll enjoy the lecture, and I will start with the first question. True or false? If you are the patient for gastric bypass, you will feel full, you will feel more hunger after the gastric bypass operation. This is mainly something you face with your patients. Common question comes from them. So what do you think? Is it a true or a false statement that the patients will feel more hunger after a gastric bypass operation? Kim, give me just like an assumption of some of the answers, please.
Sure,
What is
Dr. Wafa.
the comment, true or false?
The common answers we receive are false.
So most of you, I have 11 people, all of them are writing false, right? Or some of them have true?
I have seen around 5 answers true and the rest are false.
Okay. I'll wait for a minute since still we are having answers. I can see nice contribution. Thank you. Great, great. Excellent. I'll stop on the 45. Okay, now we'll go for the second question. True or false? Gastric bypass is good surgery to resolve diabetes. Gastric bypass is a good surgery to resolve diabetes. True or false? Kim, you can see the answers, right?
Yes, Dr. Wafa. It's a
And
mix
what
of
is the
true
comment?
or false.
It's between true and false, yeah?
Yes.
Okay, so keep your answers till the end since it's 50-50. We'll go for the last question. What the following are advantages for gastric sleeve? No rerouting of the intestine, less concern about vitamins and calcium, no adjustment necessarily, weight loss similar to gastric bypass. It's all of the above. So what do you think? No rerouting for the intestine, less concern about vitamins and calcium, no adjustments necessarily, and weight loss similar to gastric bypass, all of the above. Can I see some answers?
Most of the answers are all of the above and between option 1 and 2. I see option 4.
Okay, so by that, I'll start by my talk. What is the gastric bypass surgery? It's a surgery considered to be a life-saving procedure to lose weight that will reduce comorbidities and feel better and look better. So mainly, if you see the first definition, it's a life-saving with comorbidities, not like what I can see nowadays. It's like I just want to make myself losing weight with none of those criteria is there. I have no comorbidities, just I want to look better, which I disagree on that. Now, weight loss surgeries, it's a tool. It's a tool that can help to achieve long-term success. And this tool is a diet. The key of it, that it's at the end, you are following a kind of a diet component to fulfill the criteria and to make the surgery which have been done a success story. Knowing what they can and they cannot eat, this is the first step towards a healthy diet. So the diet for the first 5 weeks after the gastric bypass also is very important. So it's before and after, it's important. And especially the first 5 weeks after the gastric bypass surgery. Why is that? Because of safety, as eating the wrong food could really make a problem and really harm you as a patient and undo the pressure on the healing of the stomach. And also, it's a resetting of the bad eating habits and replacing them with a new healthy habits. Because, as we all know, it's a lifelong thing that you have done. So you have to make sure that these habits have been corrected and your patient is following these new habits. And this bariatric plate, it's very nice. I like the plate anyway for all kind of treatment, for weight reduction without surgeries, for healthy eating. But here you can see something different in this bariatric plate that goes with what? If you can see that that the protein is higher, the vegetable is minimized, and very minimal carbs, which is around 2 tablespoons. Fluids are there around 64 ounces. We're going to talk in details in the few coming slides. Now, very important to concentrate on protein, high protein diet. High levels of protein are very much needed to protect the muscles and to keep the body from using muscles tissue for energy instead of excess fat when very low calorie diet. And this is, I think, very common. Most of you knows that even with a very low calorie diets that people follow for just weight reduction. We don't go for that because it really can, you will start losing muscles. So protein should be high in those bariatric surgeries to help to heal, first of all, and to recover faster and not to lose your muscles because we don't want any muscle wasting. So the pre-op diet that your patient should follow before he starts to go for any kind of bariatric surgery is from 70 to 120 grams of protein each day. Of course, it depends on weight, height, and their special assessment. We all agree as clinical dietitians that we have to tailor the diet with the patients and according to their needs. Now, importance of losing excess fat before surgery. Why we let these patients follow a diet and we want to make sure? Because a reduced calorie diet is very much necessary for reducing fat level in the surgical areas and to increase the surgical safety. This surgeon have to go deep, so he have to have a safe entry. The typical pre-op diet range usually from 800 to 1,200 calories per day, and it's very important to lose excess fat around the liver and the stomach, as well as to help the shrink of the liver. Reducing the fatty triglyceride from around the liver and the spleen, it helps to reduce the surgical bleeding. In most patients, our surgeons, and I knew that a lot of surgeons are with us today, a lot of the surgery, they might postpone it if they have too much, very large liver. So they have to follow, they have to comply, and before going to the surgery to make sure that it's for their own safety, for their own saving life and to prevent any kind of bleeding coming on. Now, Now, again, when we talk, that's why we said we have to give a high protein diet. And protein supplements are really the primary part of the pre-op diet. Protein powders are specially formulated for a bariatric patient to help to lower fat content, minimize recovery, and promote weight loss. And these protein powders can be mixed with low-fat milk, fruit juice, or fat-free yogurt, whatever the patient's acceptance, and it will be replaced with a liquid protein diet at least 2 days just before the surgery. The time frame for the when to start it, the time frame for this pre-op diet will vary for each patient based on their weight and type of the bariatric procedure. So each procedures have his own characters, but I'm talking in general. Now, for more involvement procedures such as gastric bypass and epidural switch, or the pre-op diet may start 2 to 3 months before the surgery. While if you go for just gastric band surgery, the pre-op might start 1 to 3 weeks before the surgery. So it depends on the surgery. And why is that? As I said, to prevent any complications, to prevent even psychological trauma, which happens for so many patients that we don't want them to end having a problem. And we heard a lot of patients have went into a psychological trauma, even suicide after that. So we want to make sure that our patients are well trained before they have any surgery. The surgeon will assess situation. He will determine how much weight need to be lost before the surgery and the length of the time needed to lose the necessary excess of weight. And then he will discuss it with the dietitian, and the dietitian then will put whatever needed for the patients as a regimen to follow pre-op. Now, the purpose of this diet before bariatric, as I said, to reduce the fat around the liver. Look at this picture. Why liver is shrinking is required. Now, to make the way for the surgeon instrument during the surgery, to give the surgeon better line of sight, and to help of losing the weight before surgery. Three main important needs of following the diet before the operation. And the pre-surgery diet is designed to reduce this fat around the liver, to preserve and protect the muscle tissues, to improve the surgical outcome, and of course, if you improve it, then your outcome, then faster recovery you will have, increase the rate of weight loss, and prepare your patient for what? He have another diet to follow, which is the post-op diet, which is, again, we don't want them to go into psychological trauma and saying that he used to have like 4 breads a day. He have to have just a small 30 grams, 1 ounce. It's a big difference of eating. So this can cause really a harm. So we want them to comply, and we want them to be safe, and they want them to heal, and then we want them to have a faster recovery. Now, it's not the time when we give the pre-op bariatric, it's not the time of binge or indulge. The typical pre-op diet is high in protein, but it's lower in fat as well as in carbohydrate. And as I said, from 70 to 120 grams of protein per day, while the calories, and it will be the main source of calories, and the calories will range according to the patient's need from 800 to 1,200 calories. This is a sample for one of the pre-op. Of course, it's just a sample menu. You can do it according to your patients, with your doctor, according to your clinic. You can see breakfast and lunch, totally protein shakes. Goes for a dinner, the amount of protein comes from meat, fish, and chicken, and it is calculated accordingly how much they should take per day. There's a lot of pre-op samples menu, but this is one of them to share with you. Now, the first 1 to 2 weeks pre-op will include the following elements. First, protein shakes or meal replacement shakes, will be in the diet as a primary component. Only sugar-free beverage should be taken. No caffeinated or carbonated beverages are permitted, and soup, broth with no solid pieces of food may be consumed. And overcoming why is that? Because we have to make sure that we are overcoming the side effects of the pre-op bariatric diet. Point number one, when you consume less caffeine, decrease the coffee from 2 cups to 1 cup, then from 1 cup to half cup, then from half cup to quarter cup. Gradually doing that to your patient till the time of the surgery. Point two, stay hydrated. When you have more water to be drank, more decaf fluids to be given, such as tea and coffee, and infuse water as much as you can, and diet juices. Now, as well as we can take vegetable soup or vegetable juices are acceptable. Extremely thin cream of wheat or cream of rice also can be eaten. Once 1 or 2 daily servings of lean meat, it might be okay, but only if they are approved by the surgeon and your dietitian. Now, all beverages and liquids should be sipped very slowly. Beverages should be consumed with meals, and patients should wait at least 30 minutes after the meal before consuming any type of liquids. Separating the liquids, the solids applies post-operatively after the surgery, but it is good habit to start pre-op. Why we are doing that exercise? To tell them that post-operatively, this is what's gonna happen. So this, if you can see in this picture, I put it in a daily meal plan. You can tell them how much they can have. You can create for them 3 recommended meal replacement shakes per day. Food items which is allowed, like 1 small meal, which is 400 calories. So all this is a training for the post-operation, and this again goes for the favor of the health of the patients to make his surgery goes in a safe mood. This is one of the 1,000 calorie bariatric diet that you can see. We put the breakfast, lunch, dinner, the totally, and also the snacks, and it is calculated how much calorie per protein to give me from 70 to 74 grams of protein, 990 calorie per day for this patient. Of course, as I said, it goes from 800 to 1,200 calorie, but this is the way that we calculate it for the patient to see exactly how much he's having per meal, what kind of food he should take, and what kind of food permitted to be taken, or what should he drink, and what is not allowed to be drank. Now, there's as I said, the replacement during the pre-op, prior to the surgery, the body needs to go for ketosis. And this allows the body to use what? To use the fat stores as an energy sources. So when you go for a very low calorie diet, then you can go for ketosis, and that helps to use this fat that you have in your body to as an energy source. The results is that the fat in the liver shrinks considerably in a very short amount of time, and this is what we want for pre-surgery. Now, screening should be there, and this is very important for all kinds of patients, whether they are for surgery, as soon as they are admitted to the hospital, screening is very important. It gives you an indication about your patient's health. You go for the BMI, if they have any intentions of weight loss, or they have been eating less than 50% of their normal diet in the preceding weeks. If any of these answers are yes, or their albumin is less than 3, then you go for pre-op nutrition to be given as supplementation through your dietitian. Now, there's a career path for those patients with low risk and high risk. And this is algorithm that can show you what to be given for those patients and to do the intervention needed for these patients. Now, for the preoperative, this is the care pathway. First, he is scheduled for the surgery. Second, then we will do the assessment and we will measure the albumin. 3, if he is at low risk, then there will be an intervention, given oral feeding, oral supplementation, pre-op for the surgery. Then surgery to be given oral intervention 7 days just post-operation. Now, if they are at high risk, we'll do the same steps. If they are, we'll do the schedules for the surgery, they will do the assessment, and if they are at high risk, then they have to go for the dietitian. She will give them the home therapy, whether ONS, whether enteral nutrition, TPN, whatever recommendation is needed for that patient. Then weekly calls for telehealth to follow this patient to make sure that he is compliant to what is given. He has to come back to visit her and the clinic to check whether they are ready for the surgery. The weight gain is stabilized. He have improvement for the albumin. He have improved as the nutrition. He's not no more at risk. Then they will go for surgery and appointment for that surgery. Now, scheduled for the surgery, they will do the scoring. We have, we call it the PONS malnutrition screen. And this is done the POIT nutrition care pathway. We have a pre-op and we have post-op. If they are at high nutrition risk, they have to be given oral nutrition supplementation 2 to 4 weeks pre-op. Immunonutrition for 7 days pre-op, and carb loading 2 hours pre-op. Post-operation immunonutrition should be given for 7 days, and post-op then high protein oral nutrition supplementation for the coming 3 weeks. Low nutrition carry risk, go for immediately immunonutrition 7 days before op, and carb loading 2 hours pre-op, and immunonutrition 7 days post-op, then high protein oral nutrition supplementation for the 3 weeks. And in this POM scoring, they depend, as I just showed at the beginning, the previous before 2 slides, BMI, if they intentionally lose weight, and if they are taking less than 50% of their food. Now in Duke POIT pathway, when they do the scoring, high protein oral nutrition supplementation is given. Vitamin D assessment should be there, and if it is below what is needed, then 50,000 IU to be given of vitamin D once in a week for 3 weeks, then 2,000 IU vitamin to be given per day. When we go for the nutrition clinic care, the pathways, then the nutrition team, they will see the patient while he's an inpatient and hospitalized. They will give him 5 to 7 days pre-op and carb loading for 2 hours before the operation. Again, post-op, as I just said, we have to give the immunonutrition 5 to 7 days post-op, then high protein oral nutrition supplementation 3 to 6 weeks. Now, the post-dietary guidelines, he did the operation safely. We shrank his liver and spleen, and everything went fine. Then once the gastric bypass surgery is completed, strict post-op diet plan needed to be followed. And there is now a stable line in the stomach that must be allowed to heal. And certain food can be really disturbing the healing. And I saw it with my own eyes with so many patients that they couldn't tolerate the minimum amount. And really, they had suffered all night from just having not the correct food that it had been prescribed to them. So we have to tell them that they should follow what the dietitian have given throughout her plan. And once the operation is there performed, then we have to allow the stomach to heal. We have what and how you should eat will really help the recovery, faster recovery. And post-op diet will prevent the stomach from stretching and putting undue stress on the body. And it allows to get used to the smaller food, which gonna mainly help in the initial weight loss and help to avoid any kind of side effects and complication from surgery, such as the reflux, the vomiting, the pain. I saw so many side effects with my own eyes with so many patients. So we had, and really, they really in pain. So to prevent their pain, we have to really convince them that this post-op diet is very important. And the 5 weeks after the surgery, as I said at the beginning, is for safety and for their safety and for their healing, fast healing. And it will unfold in stages until they are able, these patients, it will start gradually till they are able to tolerate the solid food. And establishing a new healthy diet will be very important to maintaining weight loss successfully throughout the rest of their life. Again, as I said, the first 5 weeks following the surgery will not be able to eat much of anything. That's what we have to tell them. And the body needs time to recover and to heal from the surgery before they can start eating regular bariatric diet. So the bariatric surgeon usually will provide the post-meal plan with the dietitian designed to promote a recovery and provide the body with the adequate nutrition that they really need. Look at this gastric sleeve diet tips. Progressing of soft diet from pureed after 4 to 8 weeks. So the first few weeks were very important, but they start to have soft diets only after 4 to 8 weeks. We will go through that in a minute. Now look at the diet, stage 1, 2, 3, and 4. 4 stages for those patients with gastric bypass. Of course, it depend on the type of the bariatric surgery then, but I select the gastric bypass to show a sample because we have different bariatric surgeries. Stage 1, clear liquid, estimated duration from 1 to 7 days immediately after surgery. Stage 2, pureed food, approximately 14 days after stage 1 is completed. And soft diet, from 2 weeks to 2 months after stage 2 is completed. And stage 4, where we go for solid diet, it's again, it depends. Of course, this is a patient's lifetime. No duration is there because this is what he's gonna continue in his life, but it is calculated according to their needs. Now, during the stage 1, clear liquids consumption schedule is there, and during this phase, it's very important for these patients to stay hydrated. Some surgeons may also want to start with protein shakes a few days after surgery. So we will see what the surgeon wants, and we will follow, and that depends again on the patient situation. But in stage 1, usually we go for clear oral, clear liquids only, water, clear broths, sugar-free liquids, thinned juices, sugar like Jello, decaf tea, coffee, and also all of these are measured with a measurement. Now, the first 1 to 7 days after gastric bypass surgery, only clear liquids are to be consumed at the rate of 1 to 2 ounces per hour. Why 1 to 2? Because some of the patients really couldn't even take the one. So that's why it have to be slowly, timely, and with patience. they have to have patience. And the patient's dietitian really will decide how long this phase will last according to the healing of this patient and following the guidance of the surgeon and the clinical dietitian. These clear liquids recommended by the dietitian will, as I said, have water, fat-free milk, fat-free broth, sugar-free jello, and it depends on what the patients have. Now, this stage of post-op diet usually lasts, as I said, from 1 week, occasionally 2 weeks. Again, depends on the patients. And because of the patient's smaller stomach size, the individual should have several small meals throughout the days. And usually we include 60 to 70 grams of protein shakes, egg whites, pureed meal, fish. And usually they give them protein powders to add them to their juices to increase the protein, to reach to approximately 64 ounces, about 8 glasses of clear liquids as defined on stage 1 and not counting the fluids in the pureed food. Clear fluids should be sipped very slowly, and straw should be not to be used because it might bring some kind of air which into the stomach, which usually disturb them and take space of whatever food they should have taken. It's necessary to take the vitamins. There's a multivitamins prescribed by the surgeon. It should be taken and followed to prevent any kind of nutrition deficiencies. And this is, if you have seen them, or if you practice to see some of those bariatric patients, it's usually either in liquid form or chewable. And it's because sometimes it's difficult for them to swallow. It is also important to supplement your diet with calcium citrate. Its recommended amount will usually be 2 to 3 doses, with each dose range from 400 milligram to 600 milligram. Calcium citrate supplementation should be separated from the multivitamins dose by at least 2 hours. And this is because of iron and calcium can really interfere, and we don't want to lose any kind of minerals or vitamins. They interfere in the absorption of each other. Now, in stage 2, this meal plan will look like that. Soft diets in this stage, the diet will allow for a very gradual reintroduction of soft food in the diet. And this stage usually lasts like 1 to 2 weeks. If the food can be easily mashed with fork, knife, or spoon, then this candidate can go for stage 3. And I saw some of the patients really have gone into from stage 2 to stage 3 very fast. Because they really were very excellent candidates at the beginning. This portion of the diet will include soft meat and cooked vegetables, and the nutrient goals will remain the same in stage 2, 60 to 70 grams of protein and 64 ounces of fluid is recommended daily. And the serving size of protein in this stage 3 should be 1 to 2 ounce, likely to have 3 to 6 meals per day. In stage 3, we focus on the quality of protein sources. And while, by the way, in stage 1 and stage 2, I saw so many patients losing weight and losing protein, losing muscles. That's what we don't want. So we want, when you follow your patient and take the measurement, assure that they are taking the good quality of food, protein in that period of time, because we don't want to have muscle wasting or their protein intake to go low. In stage 3, while 3 continues to focus on high quality lean protein sources, up to 3 servings of soft vegetables may also be allowed. Tiny portions of fat may be also permitted. This portion of fat probably will be formed in a single serving of fried, like for example, avocado. So it depends on how your patient need and accept food and what exactly they like to have. Look at this the sugar-free juices, cooked mashed food, pureed vegetables, pureed food, mashed fruits, as well as soft mashed chicken or tofu, or oat meat cereals. All this can be included when you want to give the patients the food in stage 3. So you have to make sure that you are sitting with the patient, talking with them, explaining to what they like and what they didn't like. And very I don't know whether any of you have experienced this, but so many patients used to like something after the operation, they hate it, and the opposite is correct. Some of the people, like they for example, they hate fish and they didn't want to have fish. Now they start having fish because maybe it's the soft source of protein that they can take with no harm, like that red snapper or that small fillet, white fillet. They are having different type of foods. Even the taste of the food differs. That's I experienced with some, again, also for my patients. Diet consisting of protein, vegetables, and limited amount of grains are very little, if any, refined sugar should be followed for the rest of their life. Now, the tip for starting this solid food, first of all, and this is very important, introduce one new food at the time, ideally not more than one new food, so you can see what your body react to it. Because if you take more than one, you wouldn't know which one that caused the disturbance for your patient's body. So you have to start it, and they have to write it in their diary. Today I have started to have meat. Tomorrow I with the similar food that he had been used to have it earlier. We have to tell them to eat very slowly, and this is recommended even for healthy people. Chew your food very well, 15 seconds each bite. Separate food and water by at least 30 minutes between them. So you can, because if you have water, then you will not be able to finish the food which is recommended to you. Then you will start have lack of nutrients. So we have to make sure that there's a separation minimum, 30 minutes between them. Continue to drink this 64 ounces of water per day to stay hydrated. Make sure that they have the protein first, then the vegetable. At the last is the carbohydrates. Ideally, we recommend them to have the healthy grains, fruits, and not processed food. Eat real nutrient-dense food, as I said, and stay away from any pre-packed processed food, because this harms the body a lot. And they have to read the labels. Focus on very low carb diet, low carb food and high protein. The ratio 10:1 or less. Add it to their food of. Add 0 to the grams of proteins, and if the total calorie are more than, then you want to maybe avoid this kind of food that you are eating. So when they read, they have to see the calorie to protein ratio. And as I said, add 0 to the proteins. If the total calorie is more, then avoid this food, because you'll have more calories, then the weight reduction will be effective. Again, another way of showing the phases with weeks. Phase 1, clear liquid diet, water bath, flavored water, sugar-free jello. It goes for 1 week. Phase 2, the thick liquid diet, protein shakes, Greek yogurt, apple sauce, high protein soup. This is week 2. Phase 3, soft food diet. In week 3, beans, cottage cheese, fish, well-cooked vegetables. And in phase 4, regular food for weeks, fish or shrimps, chicken, eggs, nuts, and vegetables. Now, in summary, all the phases. Clear fluid diet, the first phase of the diet progression is clear fluids, which are, you can clear, that means you can see through them. Full liquid diet, once the body is stable to tolerate the clear fluids, then you begin to add the full liquid diet, where you have the low-fat yogurt, sugar-free food, protein shakes, low-fat cream soups. Then the pureed diet, the pureed food diet phase, where the pureed food and soft diet is there. Smooth consistency, like the baby food. Very low calorie sauces, very high protein food. Soft, then the following phase will be soft food diet phase, and where the food texture are tender and easy to chew, as ground or finally lean meat or soft fruits, cooked vegetables, pastas, rice. And we here tell them, as I said, to chew 30 chew per bite, 15 to 30. And the eating meal will take around from half an hour to 1 hour to finish it. So slowly eating. Solid food diet. Once you are able to eat, your patient's able to eat the soft diet without any significant difficulties, the bariatric surgeon will begin adding the solid diet, solid in the diet, and gradually till you reach to your target. And the diet will focus on low-fat protein sources and healthy high protein sources, healthy whole grain fruits and vegetables. Now, always there's a shopping list. Whether it's a bariatric or not bariatric. But for bariatric, but before the surgery, pre-surgery. When patients comes home from surgery, they will probably not feel like going to grocery shop. As I said, we want them to prevent any kind of trauma. So it's very much easier for the patients if they prepare ahead of the time and go shopping before surgery for the food that they will need after the surgery. All bariatric surgeons will provide the patients for what is needed with the clinical dietitian, what is recommended for their food list. And they have to follow the dietary guidelines. We proceed gradually through the post-op diet phases. We choose the healthy food. We focus on low-fat, high-protein food sources. We keep small meals and stop eating when they feel full. They eat very slowly, from 30 to 60 minutes per meal. They chew food thoroughly, 30 chew per bite. And they drink a lot, stay hydrated, drink plenty of food, 64 ounces, as I said, but avoid drinking between meals, because if they did it, then they cannot finish the meals that they're supposed to have, and then they will go for malnutrition. Some of the commonly suggested food items, post-operative diets, we tell them to bring like non-acidic juices, sugar-free, non-carbonated beverages, skim milk, pureed baby food even, protein powder, chewable multivitamins, low-fat yogurt, low-fat cheese, oatmeal eggs. All this can be added to the shopping list when they go for be ready when they did the surgery and go back home. This is one of the, to show you the stage 4. When we finish and we reach to stage 4, this is how they can have the soft diet in stage 4, like small piece of potato, carrots in thin gravy, soft cooked chicken, fish, turkey in a very thin sauce, decaf tea or coffee, wheat, rice, porridge, with skimmed milk. All this is, it's gonna be there as an example of a soft diet. Again, it's tailored according to your patients. Now, with all of that, with Corona is there, we have to make sure that their immunity is good. So we have to make sure that we are supporting as well their immune system. We may overwhelmed by the message by advertising for the boost of our immune system, but our body uniquely designed to fight the foreign invaders without outside help. So we have to make sure that we are building our inner body in a good way, having a right build blocks on board will help our body to do the thing itself and fight any kind of viruses. So immunity can be defined as our body defense system that can help fight against any harmful microorganisms for entering our body. So, but your daily habits include stress, and, irregular sleep pattern, sedentary lifestyle, poor diet really can harm your immune system. Now, with bariatric surgery, you have the trigger of harm be under the microscope and be more fragile. So you have to make sure that when you do the bariatric surgery, with our situation now, I have to have a good defense mechanism. I have to have a good protein to help the cellular repair and recovery, adequate protein really needed for to make the antibodies and perform our DNA repair. And we simply can take it from the highest molecular value of protein, which is in eggs. Peas, soya, nuts, seeds, fish. And to prevent deficiency, we have to go from 40 to 60 grams per day. But on the bariatric, we said on the first few weeks, we go from 70 to 120 grams. And we go for the recommendation. Similarly, for the carbs, we give them what they're supposed to take and what sometimes they can take and what they have to avoid totally. Similarly, for the fats, we give them what they're supposed to take from unsaturated fatty acids and saturated fats, and what kind of food they should take and what kind of food they should avoid. Micronutrients are very important for bariatric surgeries. All patients need to take multivitamins, 2 to 3, 400 to 600 milligram doses of calcium citrate. With each of these doses can be taken at least 2 hours apart from each other. And the dietitian will recommend to take 1,000 IU of vitamin D3 if you are not deficient or insufficient. This is almost likely to be divided to 500 IU doses. And this should be taken with calcium citrate. And also a daily dose of vitamin B12, 500 to 1,000 microgram may be recommended, because some dietitians say they might start to begin the vitamin D with the vitamin B12 supplementation in stage 2 after the bariatric surgery. Now, vitamin B6, folate, selenium, iron, also prebiotics, probiotics can influence the immune system response and the healing after the bariatric surgeries to prevent any nutrition deficiencies after the bariatric surgery. We always tell our patients to choose the nutrient-dense food, very most often limit empty calories and avoid decrease the immunity by promoting inflammation. Because if I have the food that gives me empty calories, that is no nutrition value, this can promote inflammation. Vitamin A is very important to protect against infection by keeping skin and tissue and mouth, stomach, intestine, and respiratory system in a healthy body, especially after bariatric surgeries. And we go for the recommended daily allowances of what is recommended to be taken from vitamin A. Vitamin D also plays an anti-inflammatory properties and crucial for building a strong immune system. We take it, includes in oil, salmon, and fortified milk, and definitely the sun. Definitely, we have to expose our body to 40% of our body to the sun, minimum 15 to 30 minutes a day, depends on our skin color. Vitamin D only works for immunity in the presence of vitamin A. So I want to make sure that vitamin A, I'm having a good sufficient vitamin A if I want vitamin D to work in helping me to have a good immune system. Zinc have also now a lot of studies coming up that it have a strong link between having zinc and good immunity. Almost single level of for immune defense zinc is needed. And we can have it from regular food, or we can have it as a supplementation. Lifestyle habits to boost the immunity: good sleeping, good hygiene, good exercise, and definitely stress reduction. When we have a good sleep, that means we reassess our bedtime routine to maximize the rest. Hygiene, hand washing, very important in the while we are in COVID and the corona is still there. We have to assure that hygiene is very well tolerated, very well done with those patients who have done bariatric surgery, and even for regular people. Exercise according to the doctor's recommendation. Why is exercise is important? Besides boosting immunity for bariatric surgery, when it is requested to start doing exercise, walking, swimming, because when they start losing a lot of weight, we don't want to have that skin to show, and we want their body to become tight. So you have to ask the surgeon when to start doing exercise to have your body shaped in a good way. Whenever one talks about losing weight, some diet pattern, nutrition quality is and quantity are very important. We have to make sure that we are having the good food that boosts our immunity, and we have to eat the right portions after 2 to 3 hours. And of course, what we have, the seasonal fruits and vegetables should be included in the meal. Physical activities and exercise, as I said, they can start in bariatric surgeons after they bariatric surgeries after they ask their surgeon, but mostly they start on stage 2: walking, running, biking, weightlifting, aerobic. They can do dancing, hiking, whatever they like. It depends on them. Getting at least 30 minutes of exercise 5 to 7 days a week. It doesn't matter how you do it, but just do it. And this is what we tell them. So you don't do lift more than 10 pounds for at least 6 weeks after the surgery. Again, we have to make sure that we are the patient have discussed this matter with his surgeon to assure that he have the proper to prevent any kind of internal stitches or hernia coming up. In conclusion, gastric bypass is one of the safest and most effective form of weight loss for patients who have comorbidities and life-saving. And this is often to has the gold standard, and you will lose weight with the gastric bypass on average of 70% of the excess of weight. But however, it's up to you to keep the weight off by following the proper diet, following the proper regimen, and following the guidance of the surgeon as well as the clinical dietitian. So by that, these are my references, which I have done the talk from the nutritional guidelines of after bariatric surgeries and during surgeries. Thank you very much. We will go for the questions that you have answered at the beginning. Question number 1, true or false? You will feel more hunger after the gastric bypass operation. False. Most patients no longer feel hungry after the weight loss. And actually, I have experienced one patient that she have lost for 1.5 months. She doesn't have that trigger of feeling hungry at all. And she was telling me, Wafa, I'm afraid that I will never feel hungry again. And I will never sense that feeling that she forgot herself to eat. And this is another problem that you as a clinical dietitians and surgeons have to focus on it to follow the patient. That's why we have to follow them very thoroughly. The sense of hungry is not there, of hunger is not there. So they don't eat. Some of them, they forgot to eat. Then they start have malnutrition. They might faint. They might feel dizzy. So be careful with this, with your patients, and follow them closer. Now, the second question was true or false, gastric bypass is good for surgery to resolve diabetes. It is true, gastric bypass have shown a good surgery to help resolve diabetes, especially in those who have diabetes more than, less than 5 years. The patients who have it for like 20 years or more, 10 years or more, it was still they had to take some medication, but the people who are less than 5 years, they have tremendous, excellent results. The last question was the following are advantages of the gastric sleeves. No rerouting of the intestine, less concern about vitamins and calcium, no adjustment necessarily, weight loss similar to gastric bypass, all of the above, and it was all the above. They are all advantages of the gastric sleeve operation. And I said in the gastric sleeve, of course, it differs of the other bariatric surgery. By that, Kim, I end my talk and I'm waiting for the questions.
Thank you so much, Dr. Wapo, for giving that wonderful lecture. To proceed with the Q&A, I will read the questions and you can address them. First, the question from Ms. Jawahir. For how long should the patient use protein supplements after surgery and how much?
Now, again, 70 to 120 grams of protein should be taken in the diet. That cannot be achieved, Jawahir, by the regular food. Try to calculate it yourself by diet, but it can't be reached. So you have to give the protein supplementation. Again, there is a problem with the protein supplementation. So many of them, they don't like the taste. So you have to have, to do your own experience by trying to give the best protein supplementation. Like for the till stage 3, you might need that protein supplementation, but the amount will be decreased. Stage 1 and stage 2 will be from 70 to 120 gram per day of protein supplementation of protein. So you can reach to that by food, calculating the food that your patients are taking, and from that you can add protein supplementations or protein powder. Yes.
Thank you, Dr. Wafa. Next one from Ms. Nadia. Unfortunately, most patients not follow the pre-op diet. In this situation, they will feel hungry as usual, or they will be shocked.
I totally agree, Najla. That's true. That's why we have to convince. Actually, it have to work with the surgeon. The surgeon shouldn't do the operation unless the patient is compliant to the pre-op. You saw how much important the pre-op and how we do it as if it is post-op because of this shock and this trauma, and it happened. So many people have suffered after the operation when they didn't follow any kind. It's also mentally we have to do the treatment of those patients. So yes, you are absolutely right, yeah, Najla. Yes.
Thank you, Dr. Wafa. From Javeria, are there any specific fruits and veggies prohibited during pre and post-op?
Now, pre, no. Post, yes. Post-op, at the beginning of the few weeks, they cannot take anything like jawfa, anything that have seeds. It will really disturb them. And as I said, it always should be puree and liquid. So all the things that have seeds, you cannot. But if you remove the seeds, like watermelon, for example, they can have it. Similarly, the vegetables.
Thank you, Dr. Wafa. From Ms. Hala, please name some brands of protein shake.
We are in DHA using the Optifast, but there's a lot of shakes are there. It depends on whatever you have in your hospital. This is what we have in DHA. Yes.
Thank you, Dr. Wafa. Next question from Ms. Hala. What is immunonutrition?
Nutrition that increase your immunity. Where it is rich, which increases the vitamins and minerals that increase the defense mechanism. When you have a good body, I mean, it comes from a healthy diet that have high vegetables, high fruits and vegetables that give you all the needed recommended daily allowances of your vitamins and minerals that can really help your body to build to let's say fight against any kind of virus. And that's why if you see the corona, some people when they have it, they have some symptoms. So others they don't have any kind of symptoms. So it depends on your body system and immunity. Yes.
Thank you, Dr. Wafa. Next question. What is the nutritional supplements recommendation and how much, and is it for lifelong?
First of all, it depends on the, I mentioned vitamin A, I mentioned vitamin D, I mentioned vitamin B12, B6, citrate. It depends, first of all, on the kind of bariatric surgery done to the patients. And the recommendation of multivitamins should be taken because some of them, especially B12 and iron, might be affected. So yes, you have to, some of them have to be taken lifelong. And this is actually have been said by all the surgeons prior to the operation. Yeah.
Thank you, Dr. Wafa. Next question. How to calculate protein needs for patients after operation?
It depends on the weight, height of the patient. And as I said, we start from 70 to 120 grams, depend on the weight of your, we give high protein diet. It depends on the weight of the patients to reach to the maximum 120 gram per day. What is the, okay, what about the lentil legumes? I haven't seen any slide reference, reference about lentil legumes. Because, okay, now they are mix of protein and carbs. Yes, you are absolutely right, Jawahar. Javera. But post pre, we don't have any problem. Post operation, they might cause gases. They will feel full immediately, and they will not take to reach to the exact amount of protein that you need to take. Like a lentil, for example, a bowl of lentil, how much grams of protein? It contains 7. So I want to have from 70 to 120 gram protein. Do you think how much I can drink from this lentil? Besides all legumes, mainly, you can add them later on in stage 4 as in the regular diet. Because at the beginning, gases and disturbance, colics are there. They cannot tolerate anything that can trigger this gases and colics to happen with them. Yes, I answered that. Which type of protein supplement can be given? I have just spoken about. I spoke about what we have. Salma, we have, as I said, we have more than one type. You can have the protein. We have so many in the market. Bene protein, thickener, so many from so many companies. We are using the bene protein as well as Optifast, so for pre-surgery and bene protein post-surgery. What is the recommendation? That's what we have in our department, but I don't know what is in your hospital. Calories post-op from 800 to 1,200 calorie post-operation. Can the patient use artificial? Again, any calories or proteins depends on the patient's weight, height, their body composition. Accordingly, we calculate. Can the patient use artificial sweeteners post-surgery? Yes, they can. Of course, they can, but not at the beginning. It will cause gases for them, and they might cause also diarrhea. So I don't advise. That's how long does this need to stay inside hospital after surgery? 2 days. It depends on your, if there's no complications happens, then it's 2 days, 3 days max. Till you take the first liquid and you absorb the 30 ounce that start, and then you will see. What are the food that increase immunity? I've just said them. all fruits, vegetables, a good amount of protein, no processed food. All this can build a healthy, balanced diet. How we can measure the success of the surgery, how to determine the patient lost optimal weight. Now, this is very nice question. How to measure? First of all, you are going to the patient going to the dietitian every week, I think, at the beginning, and then every 2 weeks. And they will see the weight loss. It depends from one patient to another. There's nothing um, they don't, I mean, there's not a single fixed number of weight reduction. From one patient to another, it varies. But your patient you have to make sure that he's not losing protein and he's not losing muscles, that he's losing weight from a fat. That's what, this is your main concern. And that's why when you see your patient start losing weight and it's coming out from muscles and protein, then you have to increase the protein intake and make sure that your patient protein is calculated properly. After the operation, when the stomach becomes so small, that's why you don't feel hungry. It becomes very tight. They don't have that sensation. It happens after the surgery with most of the patients, most of them, not all of them. How can we, okay, what is the reason behind the absence? That's what we said. How can we interpret the weight loss progression post-operation? It depends, Yalama, on your patients. The very obese, they lose more than like if they are 150, 200, 200, 300, less than, more than 100, they lose more weight than the people who is less than 100 kilograms. We give them any high protein EN or EN formula, close formula for the leak. There's a lot of, we have, thank God, in UAE, we have all the EN formulas are there. It depends on your patient's situation, whether he's diabetic, he's having, what are the comorbidities that they have, and accordingly. But we have to take it to make sure that it is high protein and low calorie formula, and we have that.
All right. I think that's it,
There's
Dr.
still
Wafa.
so many.
Yeah, there are so many questions we would like to address, but I know you are really busy and you've been through a lot this following days, and we just wanted to thank you, to take
You're
this
welcome.
Opportunity to always thank you, Dr. Wafa, for being with us.
I would like to thank all the people who sent the questions. It was amazing. Thank you for your listening. Thank you, Kim. Thank you very much.
Thank you, Dr. Wafa, and for all these questions, we will collect them all and send.
I'll answer them. Yes.
Yes, definitely. So once again, Dr. Wafa, we would like to thank you, to take this opportunity to thank you and for your time, for giving this wonderful lecture for all our attendees. And it was always a pleasure to work with you. Before I close the session, would you like to add anything or to comment?
Just to tell you, thank you very much for this invitation. I hope you have benefits from the lecture, and looking forward to see you again, to hear you again. Thank you for all the people who have sent the questions. I will, inshallah, answer them. Take care and stay safe, please. Thank you very much. Good night.
Thank you so much, Dr. Wafa. And once again, thank you to all our attendees for tonight and for our speakers and collaborators. And we would like to thank once again Nestle Health Science for sponsoring this event. I'm not sure if one of the representatives is with us, but thank you for your time and for going with us through all this late night to stay with us throughout this evening. Once again, everyone, we would like to kindly remind to please continue to follow, share, like, and subscribe our social media accounts for you to be able to see all our upcoming lectures, future activities, and at the same time view the pre-recorded session of TEDkeep's online activities. Once again, our course for today is accredited by Department of Health, Abu Dhabi, and your certificate or your e-certificate will be available in few days. You will be receiving an email from us with 2 links. One is for the post test and the evaluation as a prerequisite of DOH in order for you to receive your certificate of attendance, as well as the PPT or our presentation for today will be available along with your e-certificate in email in PDF format. So any questions, any clarifications, please feel free to send us an email or to send us an SMS or a WhatsApp. You'll be able to reach us through our mobile number, landline, and also our email address. If you have any clarifications or questions to address to Dr. Wafa, send it to us and we will direct it to our speaker. Once again, attendees, thank you so much, and we look forward to see you on our upcoming events. And at the same time, please book your schedule, your calendar, as we are planning to do our 3rd International Growth and Development Conference. We will soon release our announcement, and we look forward that you can attend to this conference virtually. Once again, have a safe evening. Stay safe.